Fair enough. Dr. D.K. Gupta, come in here. Dr. D.K. Gupta, now we are seeing a bit of a spike in Delhi as well, where cases have not risen to astronomically high numbers just yet. But yes, they have now gone up to about 85, 90, along with 10 new Omicron cases. Is that concerning, Dr. D.K. Gupta? And also, do you believe that it is imperative that we step up, the kind of restrictions and perhaps, measures being taken at airports and for inbound passengers, looking at the frequency now of people who are testing positive, who've just returned from abroad?
I would like to add to a few points regarding this immunogenicity and the infectiveness of this virus in the lungs and the upper respiratory tract. Like previous speaker has already told it, but I am not agreeing with the one point that it is 70 times less lethal than Delta. The study is done by Dr. Michael Chan in Hong Kong, and they have clearly mentioned that it is definitely the replication rate is around 70 times higher than the Delta, and it is more in upper respiratory tract and middle respiratory, that is up to the bronchus, but it is less than 10 times in lower respiratory tract, that is in the lungs. But it is also, they have written clearly, it is important to note that the severity of disease in human is not determined only by the virus replication, but also by the host immune response to the infection, which may lead to dysregulation of the innate immune system, that is cytokine storm. They also tell that the Omicron variant can be partially escape immunity from the vaccines and the past infection also. The overall threat, I will repeat it, the overall threat from the Omicron variant is likely to be very significant. So we should not take it lightly. It doesn't mean that if it's not replicating 10 times faster in the lower lungs, that it will be it will not create a third wave, or it will not be lethal to the most of the comorbid patients. It can be lethal to those patients, those are having poor immune response or those are having the poor immunity. In these patients, it can trickle down to the lower respiratory tract and it can create pneumonia or ARDS, and it can lead to severe infections, severe complications also. That is one thing. And if we talk about India, we have high population density in India. We have having more than 140 crore people in India. The population density is very high, and it is spreading more than 3 to 4 times as compared to Delta. We have seen in second wave in Delta what happened to India with that spread rate. If it is 3 or 4 times minimum higher than Delta, what will happen? And there are so many comorbid patients also. We are having 40 crore of our population, that is children. They are unimmunized. They are not given in a single dose of vaccine against COVID. They are high risk. They are vulnerable. So it means we should not take it lightly. I think already Hong Kong research has done, and they have told the Sinovac vaccine developed by China that is ineffective against this virus, this strain. Even the vaccine developed by Bharat BioNTech, that is Pfizer vaccine, that is having only 25% antibodies against this new strains. We need some study, we need some results from National Institute of Virology Pune or NTAG committee that what is status of our current vaccine against this virus strain. Are they effective? If they are effective, then how much they are effective? If they are not effective, then what are we doing for developing new vaccine against this virus strain? And if they are effective, then why are not we giving additional dose to our healthcare workers or frontline workers and comorbid patients? That is my question to the media and the government. I think we should be serious because it is spreading very fast. Right now, there is more than 100 cases across India right now about Omicron. Even I think there in Delhi, it is increasing. And we have seen in UK also. In last week of November, it was less than 1%. As Dr. Bagai told, it is now more than 5% within 2 weeks also. So it is replicated 5 times, 6 times more in 2 weeks only. Okay. We have seen similar things with the Delta also. In initial month of January, it was less than 1%. But up to August, September, it was more than 80 or 90%. So I think we should not take it lightly. We should follow all COVID appropriate behavior as told by previous speakers.
Okay.
We should,
okay.
Yes.